I was referred from my GP having had vague indigestion-like pain in my chest, and around March this year started coming to the Vic for various tests in the cardio unit, and then about 5 or 6 appointments later I was referred to Mr. Bowes, the cardio consultant, who recommended me for surgery. I thought the cardio unit was fabulous, and the first appointment I had there for the CT scan I thought was quite similar to what a private health clinic would look like. I've only ever been once to a private clinic, and this seemed quite similar, so I was actually quite pleased with the layout and the lounges and the way they helped you relax while you were waiting for a not very nice procedure. I can't think of any unpleasant incidents or anything that went really badly. I always thought the staff were very professional and very caring. I think the one I was most impressed with, well, apart from fabulous surgery, is it called the intensive care unit, the ICU in cardio, I thought were excellent. I was only there 24 hours, which I think is routine, but you could tell they were spot on. They worked as a team, they knew exactly what to do. They kept me well informed. They kept my relatives informed when they came in. I couldn't fault them. They were so cohesive, and they worked together so well. I just remember thinking, this is a really good place to be. The approachability of the consultants, I suppose I've got this old-fashioned idea they were sort of like distant and didn't want to talk to real patients, but both Dr. Al-Najjar and Mr. Bowes were very willing to talk direct to the patient, and they both said, if you want to talk about this anymore, just get in touch and I will talk to you. And they did, and they they gave me the email addresses of their support staff, and I got a lot of help off Mr. Bowes' PA as well as Mr. Bowes. So I was a bit surprised that people are a lot more approachable and not hiding behind other staff and bureaucracy or paperwork or anything. That I could get information direct from the consultant if I needed it. The only thing that sort of went wrong, the day of my discharge, which was after 5 days, I had to wait a few hours for the medication. They were discharging me at lunchtime, 1ish, and it was a good couple of hours before they could get the meds that they were discharging me with to me, so I could actually leave. But it's, in the grand scheme of things, that's not a lot, is it? The experience for all this series of appointments and tests and then the op has been very, very, very positive. I must also say, before I forget, the food is absolutely fantastic. I don't know how they do it. They get the food out to, well, I don't know how many patients you've got, hundreds, thousands, but it's excellent. It's well prepared, and it's hot when it gets to you. And I would have stayed longer just for the catering, to be honest. I think my relatives were also, really pleased with, the reception they got here, the way they were treated, the information they got from the staff. No problems with cleanliness or not. I suppose you only notice that when it's not there, don't you? But I think we were all very well looked after.
I've traveled the world, I've been up and down. It's been a pleasure to look after Mrs. Lymer and get this positive feedback from her. It's a fantastic advertisement for the treatment that the team gives to patients here. We're delighted to see her elaborate response. It's a team effort. The whole team are involved in patient care, and all of us are very grateful for the positive feedback that she's given us.